Hi, good afternoon, everyone. I'm Dr. Soni of Ethos Aesthetics and Wellness. Today we are going to be doing a neurotoxin injection on this young lady, and we're going to talk about, why we inject products like Botox or Dysport in the areas we do. We're also going to talk about who the ideal candidates are, some of the things we have to worry about when we're doing the injections. For example, if you put too much in certain areas, you can run the risk of either getting a heavy brow or a droopy eyelid. So these are some tips and tricks that I use to prevent those kind of complications from developing. But in general, this is a very safe procedure. It's the number one non-surgical procedure done worldwide, and that's for a reason, because the patient satisfaction is so high. These medications, some of them have been around for decades. They're very safe, they're very predictable, and God forbid, even if you get an unwanted outcome, sometimes you can, counteract that with the addition of additional units that we place, and sometimes you just wait and it wears off. It is unlikely to result in any long-term or permanent complication, and that's why it's such a beloved product, whether you're injecting Botox or Dysport. So we're going to kind of turn around and do a facial assessment, and I'm going to talk about why I'm injecting certain areas, what our goals are when we are injecting these areas, and ultimately what is the look we're going for. Most of my clients prefer a much more natural look. Yes, they want the lines to go away, but some of them prefer a little bit of movement to be left in place. 90% of the people who are probably getting these types of procedures done, you wouldn't even know if you passed them on the street. Unfortunately, we are so conditioned to some of these extreme kinds of results that our assumption is predicate that that's what I'm going to look like if we do it. So that's completely not the case. Let's kind of focus our attention on this young lady, and I'm going to start making my markings and explain along the way why we do the areas we do. So when these products first came out, the indication for the injections were predominantly kind of in that medial brow or glabella region. This is also known commonly as the area which makes people look angry, or which is responsible for the 11s. And you can take a look over here. You can clearly see we have some 11s forming, make an angry face. So you can see the movement of the muscles. This is your procerus, and this is your glabellar complex right in here. And so by injecting this area, and as you can see, it pulls everything down and in. The reason this is such a popular area to inject is when you relax it, you soften out the 11s, and you also give a little bit of a brow lift. So you're going to make an angry face. This muscle right in the center is called the procerus. You can see the medial head of the glabellar complex right here, known as the corrugators. We're going to put one here, and then here you can make out the tail of the muscle. And in general, we're going to keep things symmetrically right here and relax. Now, another interesting thing to note is some of these lines have started to etch in. While the Botox or Dysport will soften those lines, it may not get rid of them completely, because think about this. If you have a piece of paper and you keep folding it, that crease that forms where the fold is just gets deeper and deeper. Hence, we're seeing younger patients come in that do this before the crease has had a chance to really kind of etch in. Of course, there are other factors like genetics, sun exposure, that can all determine, the state of our skin, the amount of collagen we have, and overall how we're going to age. But this is, again, one of the most predictable procedures, takes a few minutes to do, and it's universally carries a high patient satisfaction rate with it, up to 95%. We can't say that about any other procedure that we do. Now, the second area we're going to go after is the forehead, right here. Lift up your brow. So you can see the forehead muscle, which is the elevator or lifting muscle of the face, is responsible for these horizontal lines. In general, when I approach the forehead, I want to keep my injections relatively high up, number one, because the lower down you get, one of the concerns is that if you relax it too much, you'll start getting a little bit of heaviness or hooding, especially in someone who is genetically predisposed to a little bit of that extra skin. We want to keep these injection points high up. We want to keep them more centralized, so we allow the sides of that muscle to continue to remain active and continue to lift up. If we go too far out and start putting injections over here, then we potentially run the risk of creating that heaviness. So by keeping it centrally, we're going to relax these lines here. We're going to allow the sides of it to keep moving up, really giving that brow lift on the side. Now, the last area that gets injected is typically, smile for me, the crow's feet area right here. These are the radial lines on the sides of the eyes. I just want to feel where the margins of her bone are because we want to keep it outside. My first area I'm going to keep down here. So the effect of this is, yes, it will soften out some of those higher up crow's lines, but it will also help in creating a little bit of that lateral brow lift. Now, what this doesn't do is what's known as the fox eye. So it's not going to do that. That's a misconception because the effect of this muscle is to generally pull down and in. When you relax it, it's going to lift up a little bit, but it's not necessarily going to come all the way to the side and stretch out. And typically I do 3 points here: the upper part, the mid part, and the lower part. Smile for me. Now, some of these lines that we may have will be softened by doing the neurotoxin, the neuromodulator over here, but some may not be. And the rationale for that is the muscles that are responsible for the smile, they come up from here. And so as we lose a little bit of collagen, even though we put the Botox or Dysport in this area, the skin will kind of accordion on itself. So no matter how much of the product you put, you may not necessarily get rid of those lines. And in addition, you can create a little shelf because it's going to create a transition zone from where the lines are relaxed to the area where the cheek muscles are still causing that lift. And so it can create that artificial shelf. So you have to know when you're going to inject the lower part, when you're going to leave it alone, and when it may be time to do a little bit of filler in what's known as the lateral cheek, when it's time to do some radiofrequency microneedling and lasers to resurface the surface of the skin. So there is no one solution to all of these problems. Sometimes using what's known as a multimodal or different techniques, tools, and products can really give you a much better outcome. We're going to swing over to the other side and smile, and you can see some of these lines that are forming the crow's feet. Now these are mainly what's known as dynamic lines, although you can see even at rest, few of the lines are starting to etch in. So again, the whole point of Botox or Dysport is to do these before these lines have gotten a chance, but this will most certainly make a difference. It will prevent them from getting worse, and combined with a good skincare regimen, combined with sunscreen, and combined with possibly lasers and such, we can actually further make those lines a little bit better. Now what I like to do is when I inject for each area, I like to use a separate, what's known as an insulin syringe. The reason is every time you inject, the tip gets dull. And what causes pain from Botox or Dysport injections is when the needle gets dull or if you're using the same needle. So by constantly, having fresh needles going in that are very sharp, it actually hurts a little bit less. You're going to put your head back. You're going to relax. We are going to start out in the center. Most of these injections are done relatively superficially. with the exception of some of these central injections, because the muscles are a lot deeper in the skin, so we're going to be injecting deeper. But as the glabellar complex kind of fans out to the side, it becomes more and more superficial. The other reason you don't want to go too deep as you go far out laterally is that some of that botulinum toxin, whether it's Botox or Dysport, may diffuse down into one of the muscles called the levator palpebrae, which is responsible for keeping the eyelid open. If it diffuses down into that, then what you could get is what's called a ptosis or a lid drop. A brow drop is when you put too much up here, or someone who's got a lot of loose skin or a lot of lines and you relax that muscle. That causes a brow drop, whereas if it trickles into here, it can cause a lid drop. So what I like to do is just pinch it a little bit and go straight in. And again, when you take your time, when you change the needles, there should be very little pain. And again, this is a deep injection because the head of that muscle sits deep on the bone. And so by taking our time, there's very little pain. Sometimes there's a little bit of bleeding, but it stops very quickly as these needles are very tiny. Now as we come to the lateral part of the muscle or the side part, again, I'm going to pinch it a little bit, but I'm not going to go as deep. I'm just going to go a little bit underneath the skin, and I'm almost going to create a little bit of a bleb or bump, like that. Coming on to the other side again. And you'll see that I'm using my other finger just to kind of create a little bit more of that positional awareness, because I want to know where, the margins of the bone are, because I want to stay about 1 centimeter above them. I don't want to inject too close to what's known as the orbital rim. So that non-injecting finger allows me to gives me a sense of where the bone is, where I need to stay above, allows me to pinch the skin, and then I'm going to go straight in and then slowly inject. The most important thing when we do these injections is to take your time, not to rush. Even though this is not a complex procedure, mistakes happen when we don't take our time to make proper markings, evaluate someone appropriately, and when we don't anticipate which areas are going to cause issues. And this is the last injection right here again, and this is one where we go superficially. We want to create just a little bit, and the center part is done. So I used 3 needles just to do 5 injections. So that, in my opinion, is the trick to keeping it a relatively painless procedure. Next, we're going to go on the upper part of the forehead, lift up your brow, and you can see most of the movement is central. Again, I don't want to come out on the side and risk it, so I'm going to relax it on the upper part. That's going to give her a smoother forehead without necessarily making her feel heavy. And these are superficial injections because the thickness of the skin here is not that much. Tiny pinch. We take our time. There's a couple of blood vessels there, so maybe I come off to the side and try to avoid. And again, you'll see there's superficial injections because you can see a tiny little bleb, a little bit of that bump forming. You don't necessarily need to go too deep. And last little pinch. Great job. And these pinch a little bit, but again, it shouldn't be a very painful procedure. The last area we're going to focus on are the crow's feet. And again, you're going to see my non-injecting hand come out and, feel where the bone is. And the other thing is I stretch out the skin between the 2 fingers. it becomes a little bit easier to inject by making the skin a little bit more taut. Pinch. Great job. We're going to do last pinch. Good job. Now, in this area, you do have to be careful because there's a lot of superficial blood vessels there. Sometimes you do hit a blood vessel and it can cause bruising, but all you have to do is apply a little bit of pressure that minimizes the bruising. And over here at Ethos Aesthetics and Summit, we actually have a laser. So in the event that we've caused a little bruise, and this becomes more useful, especially as we do fillers, and you don't want to be walking around with a bruise for 2 weeks. Some people feel that arnica may help. The clinical studies show that may or may not help. There's nothing conclusive. But over here we have a laser that actually breaks apart the bruise, and instead of having a bruise for potentially 2 to 3 weeks, within 48 to 72 hours it's already clearing up, at least to the point where it becomes manageable to cover up. We're going to swing to the other side and finish up. Same thing over here. My non-injecting hand kind of feels where the bone is. I want to stay about 1 centimeter outside of the rim. And I'm going to, again, do my first shot right underneath the brow. Pinch. Great job. Take your time. Inject slowly. And when you inject in that superior lateral part of the orbicularis oculi muscle, which encircles the eye, you start affecting the upper part of the crow's feet, but you also will get a little bit of that brow opening up, which is nice and desirable for most people. Tiny pinch. We're going to do our second injection point here. And again, taking our time. And last little pinch. 1, 2, 3. Pinch. Great job. And that's it. So you can see that by taking our time, by using very tiny needles, by switching needles from area to area, this is a fairly quick procedure, produces consistent results, and almost everyone can benefit from either Botox or Dysport treatments. So hopefully you found this helpful. This is the #1 procedure that we do at Ethos Aesthetics and Wellness. And if you have any questions, we'd love to answer them.
No questions so far.
So how was the entire experience?
It was great. I
It was
didn't
great.
feel hardly anything.
Yeah. Yeah, so just
I mean,
maybe
the pinches.
maybe
not-
small pinches, right?
a
But
tiny,
nothing
tiny,
tiny
nothing,
bit, nothing too bad.
No.
Yeah. So we're just going to gently clean it, and we're going to come back in 2 weeks, and let's just show all the movement right now. So when we do post the afters, we're going to be able to compare. Make an angry face. Lift up your brow. Okay? And right now I kept my injection points high up. She may be prone to kind of still having some movement there, and we may see a few residual lines. A lot of times, if I don't want to inject too close to the eyes, I will bring my patients back. And if I feel that I can safely put a few additional units lower down to soften those out, I will. If I feel I'm going to make her heavier, then we're not going to do that. And big smile. And these crow's feet aren't too bad. We see a few more lines lower down. In the future, we may consider something like a little bit of filler or a laser-based treatment or even radiofrequency microneedling to really start putting some collagen back. And now we're in an age of regenerative and biostimulatory compounds, things like Sculptra, things like Radius. There's even, things making its way from Korea, like the salmon PDRN or the salmon sperm products. So I think it's an exciting time to be in the field of aesthetic medicine. There are a lot of great things coming around, and we want to thank you for joining us today and hope to see you next week for another live session.